think that for some reason or another, you're correct in that fact that a lot of dentists are uncomfortable with periodontal disease and periodontal treatment, and yet in some ways it's so easy. And I think part of the conversation I'd like to convey today is it really is easy, and you guys can all do this. Basically, the way we have to think about periodontal disease is, and I think our thinking has changed. It used to be that we were taught that it's an infection, and the infection caused bone destruction around the teeth, and that it was a difficult thing to control because the mouth always is somewhat septic. So, how do you control that kind of problem? And the disease will generally be progressive. In reality, what we have is not a infectious disease, but an autoimmune disease or an inflammatory disease, in the sense that the infection sparks an inflammatory reaction. And that's a good thing because our bodies are designed to protect itself. Inflammation is positive. If that inflammation keeps getting stimulated by more and more plaque or different traumas or whatever it is that's affecting it, and that's not stopping, it's basically our systems go into overdrive trying to manage it, our protective systems. And when it hits that point, the inflammatory reaction or our defense system becomes ineffective. And not only does it become ineffective, but as part of its normal process, it's spewing out enzymatic materials and different cytokines and opening up vascular channels and causing local destruction to fight the infection. So that's what causes bone disease. It's an infection stimulated inflammatory reaction, which is dysregulated or chronic or not functioning properly as a protective mechanism. So in a sense, our bodies are destroying themselves.